They really say it takes a village. It takes a village to improve care in DMD and to move things forward. We know about the important role of clinicians in DMD. We know about patients and families, and everyone really takes their part. But patient organizations are just as important in education, in helping to move care forward in their countries, in their regions, but also globally. Let's look at some ways to improve it together. So for DMD care, sometimes what we hear is that in presentations, they say DMD patients live up to their 18th or 20th year. Sometimes I still hear that. So let's just make clear that life expectancy is changing for better. Patients are living a life with better quality of care, and their life expectancy has improved so much in the past few years. And that is mostly thanks to improved care and symptomatic treatment that we have. For these reasons, we need proactive approach towards new subjects, towards new topics like transition of care, adult life, education, social activities, and work possibilities. And with this is one of the things that we really need to work on as patient organizations to help clinicians to open these topics and turn the attention towards adult life and possibilities to be part of a social life. New areas of care are becoming important. We have a growing population of adult patients, and we need to involve more clinicians in different areas than before. So these are some other challenges. And with innovative therapies, one of the key roles of patient organization is communication around research, communication about treatment that's available, and also helping to manage expectations of families. That's one of the things that we heard yesterday from Professor Artsmarus. It's very easy to just read a title of a press release and to draw a conclusion that would be easy to jump to. For example, gene therapy now cures Duchenne. It's so important that in this area, in communication and managing expectations, we really work together as clinicians to really clearly say truth about Duchenne, but also as patient organizations. This is really one of the key things that we can do, is speak clearly about what is out there. Now, why is care the key? So, as was said yesterday, we are not expecting one drug to cure Duchenne in the near future. That probably won't be the case. It will be about combination therapies. So the quality of life will still depend on combination of therapies, regular exercise, well set up compensatory aids. For example, last year we heard about importance of seeding. So that's one of the things. It will also lean on symptomatic treatment or well-handled emergencies. So we'll reach good quality of care and good quality of life with good care. Even talking about innovative treatment, we still need standardized care to first reach the innovative treatment, and then to care for patients during and afterwards. Last but not least, most effective drugs that will come or that are here somewhere in countries available will create a new population of patients that will need specific and very different care than today. That's what we see, for example, in SMA. The population is changing, and the patients who received innovative treatment look different than patients we were used to. So in all these areas, we will need not only clinicians to be on board and up to date. So thank you for being at the Care Conference where you'll learn new things, but also we'll need patient organizations on board to be able to communicate about this and to have a clear view of what is happening in Duchenne. Now, how concretely can we help as a patient organization? Education is the basic thing that we need to work on, because if you do your best as a clinician, if you set up a really good care plan and you give good treatment that's in your hands to give, and if the family does not adhere to care, if the patient does not, focus on adherence, then not a lot of things will change for better. So the patients and their families need to be educated. We'll have a topic about this during today. But patient organization can help with translations, having educative materials of other organizations spread around their country, sharing right sources. This is so important in time of fake news and of misinformation. It's important to know where the right sources are and what good materials you can share that can make a difference. For example, about emergencies, about DMD care, about gene therapy, and how to understand research and so on. So sharing education that someone else prepared is also super helpful. Then also creating materials in native language can help, even for clinicians. Sometimes you just do not want to spend time reading something in English and applying it in your country. You just want to have it figured out for you and in your language, and you want someone to help you with that, to have materials for your colleagues, for example. So helping with translations, creating guide for families, in your own language, standards of care or emergency card. This is all suggestions, ways that patient organizations can help. Now, building a well-informed community that provides peer support can be another way to help, because peer support is really something that no clinician can rely to, or not rely to, but cannot stand up for. It is up to patient advocates to provide this. Now, we're getting to working with care centers. Patient organizations can be very helpful for care centers. First, as mentioned, with educative materials, but also in communication and handling tough situations around diagnosis, offering proactive approach towards subjects like transition and adulthood, because if the patient enters the clinic and the center, they usually, not even the clinicians, but not even the patient, have enough time to discuss these topics deeply and to go into planning and just seeing your life in a longer perspective. So this is also something that POs can help with. Also making sure that patients really know about the available organization in their country, because this is not necessarily the first thing that the clinician tells you. So you need to make sure as an organization that you're connected to your center, neuromuscular center, and that they spread the word to the patients. But also sort of building a community of clinicians is important, inviting them to events and conferences and webinars, and making sure that they have all the information up to date and that they have available all sources that they need. So patient organization can make a big difference. Now, as a global organization, WDO, World Duchenne Organization, started a program that's called Accredited Duchenne Centers. And that's a way where we see how we can help the community globally. So we know that challenges in providing standardized care really differ country by country. And in rare disease field, the need for collaboration and networking is so strong. So sometimes what you need, if you're a center in a different part of the world, in Africa, in Asia, sometimes what you need is support from colleagues from other parts of the world and sharing experience and motivation and inspiration. So what we wanted was a program to help give you feedback and also ideas, but also to support you in what you're doing as care centers. We know all from our experience that some centers provide excellent care, but they're not always recognized, and they lack arguments to ask for better conditions, better equipment, or for added staff. So sometimes this can be an opportunity to see, be in the light and say, we are doing a good job, we're providing good care, and we are motivated to even improve it. And we see families from different countries of the world, many countries of the world, who feel like maybe if I was living in the US, in the UK, I would be doing so much better because care there is better, or there is available treatment. And the families lack the knowledge that in their countries, the standard of care can be so good that it doesn't make a difference if you live in this or that country. So the aim of the program is really to reach a universal, uniform care. Among other neuromuscular centers, it's also a great challenge to stay up to date with news in DMD care. We also want to show patients where to go, where good care is. So these are some of the ideas behind starting the program. Now the program is set up with a structure of advisory board that has 12 experts. It's chaired by Professor Nathalie Homens, who is a Belgian specialist in neuromuscular diseases. We have 12 wonderful doctors, clinicians from many countries of the world sharing their expertise. The leader of the program is Professor Imelda de Groot. You'll hear from her today. She's a Dutch specialist in neuromuscular diseases. We also have Elizabeth Rom, well, you'll also hear from her today, who is the patient representative in this program, and I'm the program manager, sort of between a clinician and patient advocate. So the program was established in 2021 by World Duchenne, and as I said, the aim is uniform and optimal care for patients with DMD. The criteria was set up based on care considerations from 2018, consensus guidelines for adults from 2021, and consensus document for therapists from 2022. Questionnaires and interview guides were prepared, as well as a FAIR database to be able to work with the data that we collect throughout this program and help in the future other centers. Now, a little bit about the process of accreditation. So if you register your interest, then you get a screening questionnaire where we ask about the way care is provided in your center. If you sort of meet the criteria on paper and you have a recommendation letter from a local patient organization, then we plan a visitation where usually 3 experts, 2 care experts, and 1 patient representative come to the site, come to the neuromuscular center, and have about 2 days of interviews, of meeting the staff there, meeting the different specialists, and just discussing how care is provided and maybe making notes how to make things better. And in the end, you get a sort of a review with a few tips how to improve areas that are still lacking. And with a discussion after the visitation, you can reach the accreditation of becoming an accredited Duchenne center. Of course, maintaining accreditation is another story. So the centers are given accreditation for 5 years. I'd also like to share a little bit of feedback from the centers because they really welcome some, let's say, external view on their center. They're usually or nicely surprised because they can feel that we are so excited about the ways that, care is handled in other countries. And what we see really is a lot of creativity, a lot of challenges that the centers are overcoming and facing. We see that usually there is a struggle with the state's healthcare system that really influences the way that the center works. We see challenges in some topics and in some ways, like transition of care, for example, if there is an adult service available or not, or even transition as a topic is a challenge. We also see that it's helpful if the center cooperates with a patient organization. We see a lot of involvement in telemedicine, especially in large countries where it's harder to reach patients. And we also see that hospital leadership welcomes the visitation as a good, let's say, challenge and light. And the centers usually have, after that, a stronger argument to move things forward. This is a map of all the accredited centers right now. We have 8 of them in 7 countries and on 3 continents. 3 centers are already visited and now in the process of accreditation, and 1 center is pre-visitation. So this is a picture of all of the 8 centers, where I just want to really say how wonderful it is to get to know teams so here are listed teams from UK and Mexico, and from Serbia, Hungary, from Romania, from Poland, Turkey. So we have so many wonderful teams, and it's so good to get to know all of you, all of the clinicians that are trying to really change things for better in Duchenne. So for any additional information, please visit this website, or you can ask me, or just send me an email at karolina.podolska@worldduchenne.org. So for now, we have a little bit of time for questions, if there are any.